Discover the fastest way to evaluate potential skin cancers with the CheckMySpot app. You can get a dermatologist's opinion usually within 24 hours. No waiting, no in-person appointment, and no insurance required. Download the app from either the Apple App Store or the Google Play Store to get started. If you already have an account, log in to access all your saved information stored securely in our HIPAA-compliant patient portal. For today, we'll create a new account. Follow the prompts to enter some basic information, such as your name, phone number, and date of birth. Please note, your location will be automatically determined by our app. This is necessary to comply with federal and state regulations when offering medical services, and will also help us locate a certified dermatologist in your area in the event that your screener recommends an in-person clinical visit. Next, add your email and create a password. You will then be asked to identify your existing dermatology provider. This is so that CheckMySpot can forward any significant findings to your dermatologist in the event an in-clinic appointment is recommended. If you don't already have a dermatologist, no problem. If CheckMySpot determines you'd benefit from an in-person appointment, we'll help find a certified dermatologist near you and even forward our findings to assist this dermatologist in scheduling your appointment. Next, you'll be asked to review and acknowledge an understanding of our terms of service. You can tap the indicated link to review these, and then simply check the box when your review is complete. Once your personal app profile loads, you'll see any past uploads or notes from providers. But since this is a new profile, it's blank for now. Let's go ahead and upload our first photo. Tap the green plus sign at the bottom center of the screen. You'll notice a simple progress tracker at the top of the screen guiding us through 5 easy steps. There's also a written guide available if you're having trouble. Simply press the information icon below the progress tracker. Step 1. First, select the box for either body or head depending on where your lesion is located. You'll also need to select front or back view below the diagram to further specify the correct location. Note that toggling between front and back changes the right and left assignment. When looking at the front of the diagram, right and left appear as mirror opposites, while the diagram's back view of right and left are the same as your right and left side. Tap the specific location of your lesion on the diagram. Let's use an example case of the back of the left hand. First, we'll select the body diagram, then the back view button located below the diagram. Then, we simply tap on the diagram's left hand. The location description left hand will be automatically generated below the diagram. Be sure to confirm your location description is correct, especially right versus left, before proceeding. Step 2. Upload 2 photos of your lesion, a location photo and a detail photo. Following the photo guidelines is critical to getting the clearest picture of your lesion. If this is your first time uploading an image, we recommend you watch the full video on how to take a proper photo. Before proceeding, you'll need to confirm that you have reviewed the instructions for taking a proper photo by checking the confirmation box. Then it's time to take the first location photo. Follow the instructions for taking this photo. Confirm your photo is in focus with an anatomic landmark included as instructed. Next, you'll be prompted to take your detail photo. You must confirm in this photo your skin spot is in focus, without shadows, and composed to occupy the majority of the frame. Step 3. Once you've uploaded both lesion photos, answer a few simple questions about your symptoms. Here you can provide information such as, is your lesion painful? Is the area itchy? Has the lesion changed colors? Be sure to answer all the fields and add any family history here as well. This information helps our providers more precisely screen the appearance of your spot. Step 4. Now you're ready to submit everything for your evaluation. CheckMySpot utilizes asynchronous teledermatology technology, which is not routinely covered by insurance or Medicare. As such, each evaluation is a flat fee of $70. Select whether you will be using a debit or credit, and then complete your payment information. Please be sure to enter all payment information correctly to avoid verification errors. When ready, tap Verify Payment. Step 5. When your payment is verified, you'll be asked to review all the information you submitted for your spot. Check the confirmation box that your information and photos are accurate, and press Submit. Your case is now on its way to a certified CheckMySpot provider for review. Once you've submitted your lesion, you can expect a full disposition report within 48 hours. This report will be emailed to you and added to your patient profile within the CheckMySpot app. The top of your completed disposition report will show either a green check mark with a message that says, "Appears benign at this time, no clinic visit necessary," or you'll see a yellow check mark with a message that reads, "Indeterminate, recommend clinic visit for evaluation," or a red check mark with a message that reads, "Worrisome. There are worrisome features demonstrated in this photograph. A clinic visit is recommended to evaluate." If your report indicates benign, you're all set. You can rest easy knowing that you skipped the waiting and worry. You can continue to access prior reports and photographs after your evaluation in order to track any changes in your lesion history. Rarely, spots that initially appear benign evolve into something worrisome, but your reference details will be saved in case you need a future evaluation. You can even access your case summary report and photographs in the future to check for changes yourself. It's important to remember that indeterminate reports don't always mean something is wrong. It simply means we were unable to definitively rule your lesion as benign and recommend that you see a certified dermatologist for an in-person evaluation. If you receive a worrisome case summary report, CheckMySpot will immediately refer you to your dermatologist or the nearest qualified dermatologist for an in-person clinic evaluation. Luckily, CheckMySpot makes the referral process easy for you. If you have a current dermatologist, we will refer you for an appointment with their office and provide them with our case summary report. And if you don't have a current dermatologist, we can refer you to a qualified practice near you. This practice should contact you usually within a business week to confirm your appointment and complete their registration process. Don't wonder, worry, or wait. Download the CheckMySpot app today and get your suspicious skin spot reviewed by a dermatologist in 24 hours, because early detection matters.